Well, good afternoon, everyone, and welcome to the COVID-19 update for Tuesday, November the 17th. It's been 8 months since March 9th when I first declared the state of emergency in Illinois to address the COVID-19 pandemic. I knew then that we were facing down a kind of challenge that we had never seen before. But even so, very few of us had any idea of just how much our lives would be disrupted in the days, weeks, and months ahead. In the spring, Illinoisans faced some of the most difficult months of their lives. People began to get sick. Others lost their jobs. Healthcare workers logged monumentally long, terrifying hours caring for their patients. Office workers shifted to online. Grocery store staff stocked and restocked shelves all night long. And restaurants, bars, concert venues, movie theaters began to face incredible hardship, even with federal stimulus. For many of those hurt worst by the pandemic, the financial challenges of paying your bills and staying above water still linger. And across Illinois, hundreds and then thousands lost their lives. We flattened the curve in about 6 weeks and brought down the infection rate, so much so that we avoided the second wave that hit many parts of the nation during the summer. But as fall approached, we began to see an upsurge. And now we are seeing a COVID storm that has set us on a course to a new wave of the virus that we all hoped wouldn't come. But if you look at our new trajectories of COVID-19 hospitalizations, cases, and deaths, it's clear that it's here. There were predictions that we would have a fall resurgence that's worse than the last spring's, just like the 1918 flu pandemic. And those predictions turned out to be accurate. That's true across the Midwest right now, from the Dakotas and Iowa, which are seeing unprecedented spread, to Michigan and Minnesota facing down similar resurgences to Illinois. Our region is once again in the throes of the worst of this coronavirus pandemic. But here's what's different from last spring. By our experience and by the good work of our scientists and doctors, we have a greater understanding of how to protect ourselves from this virus. We have masks, and we know they work. We know that keeping 6 feet of distance helps. We know gathering in our home with people who aren't close family members is very risky. We know that large gatherings, especially when people are not wearing masks, can be very dangerous. And there's hope on the horizon, which became more real as of yesterday, with the preliminary reports about success of a second potentially effective vaccine candidate. But between where we are now and that hopeful horizon is an enormous challenge that we must endure, because it may be months before we see mass distribution of an effective vaccine. Right now, we're witnessing exponential growth in the number of people admitted to the hospital with COVID-19 statewide. What that means is that while linear growth is when the number of new patients in the hospital grows by the same number day over day or week over week, exponential growth is when daily or weekly percentage growth is constant or increasing. That's what we're seeing now here in Illinois. Think of exponential growth like a snowball rolling downhill, picking up speed and gaining in size. As it rolls, it gets larger and faster until it becomes something so big that it takes extraordinary effort to slow or stop it. Increases in cases and hospitalizations that used to take weeks are now happening in days. Over the last month, the rate of growth in COVID patients in the hospital has grown from a 9% increase between September 22nd and October 6th to a 69% increase between November 3rd and November 17th. This trajectory indicates that ICU and non-ICU hospital occupancy by COVID-19 patients could reach as much as 5 times our previous records from the spring. 5 times. All of our modeling groups, which collaborate with IDPH to evaluate our forward-looking outcomes in the COVID-19 pandemic, agree that without additional mitigations, this epidemic from now through September will continue to escalate, as pictured here. These are the paths most likely to occur if current trends hold without additional intervention. On each of these plots, the gray shaded area indicates a zone in which the direction of the pandemic here in Illinois is particularly uncertain, meaning we can alter our trajectory significantly if we take real action, both on the individual and policy level right now. Models project that without additional mitigations, daily COVID-19 deaths may at least match the previous spring wave and could even rise up to 4 to 5 times that level, a risk that grows as hospitals become increasingly filled by more patients and as more of our heroic healthcare workers get sick, leading to staffing shortages. Without new interventions, projections show between 17,000 and 45,000 additional deaths in Illinois between now and March 1st of 2021, assuming hospitals are able to continue providing the optimal level of care. That is 1 to 4 times what has been experienced between the beginning of the pandemic and today. We can't let that happen. We will continue to see a rise in both hospitalizations and deaths from COVID-19 for weeks ahead because of the infections that have already happened. But we can change our longer-term outcome. We can save potentially thousands of lives in the next few months if we make changes right now to stop this in its tracks. In other words, this new wave of the virus brought on by the national COVID storm cannot be addressed properly with the Tier 1 or Tier 2 resurgence mitigation plan that was designed to suppress infections regionally that were growing in a linear fashion. We must once again work together on a statewide basis to bend the curve. So starting Friday, all of Illinois is moving to Tier 3 resurgence mitigations. This is not a stay-at-home order, but the best way for us to avoid a stay-at-home order is to stay home. We are asking you to choose Zoom instead of packing people in a room for Thanksgiving. Make alterations to your routines now so that we can be together later. The virus thrives when we gather indoors without masks with people that we don't normally live with, and you'll see these Tier 3 mitigations reflect this reality. To slow the spread and until we can begin to bring down the infection rate, you should not attend dinners, events, gatherings, or meetings beyond your own household. This is a temporary set of rules that are designed by doctors to keep you safe. To be very clear, we are relying on you here. Nobody will go door to door to check on you, but we're asking people to hold themselves and each other accountable. The more we can avoid gatherings now, especially indoors with the people that we don't already live with, the more likely we are to be able to celebrate the December holidays with less risk to our loved ones and ourselves. Tier 3 boils down to this. If you don't need to do it, don't. That is especially true when it comes to gathering with people outside your household, because the terrible truth is that getting together with people in this way is exactly how the virus spreads. To stop this spread and preserve our December holidays, all of us need to do more than just wear our masks now. though masks are mandatory throughout the state of Illinois. The simple fact is that COVID-19 is spreading quickly and widely. Our hospitals are beginning to experience real strain, and at the current infection rate, they will be overwhelmed. We must not let that happen. So whenever possible, we need you, we want you to stay home. I'm hopeful that by limiting our in-person interactions now, we will succeed at avoiding a stay-at-home order like what we had last spring, when the choice between saving lives and saving livelihoods was even more stark. Tier 3 may allow us to do both. Similar to new restrictions announced over the last few days in Michigan and California and Washington, Tier 3 is Illinois' effort to avoid a stay-at-home order. Meanwhile, no matter what we do, there will be unnecessary economic pain. The virus rages on while Senate Republicans in Washington continue to block additional aid that families and healthcare institutions and small restaurants and nonprofits and cities and states in every corner of our nation desperately need. Their inaction is unnecessarily turning a pandemic into a twindemic. While states with and without mitigations are experiencing a new wave of the virus, the economy is on the verge of taking another step downward, potentially costing millions more jobs across the United States, and all because of the U.S. Senate's refusal to push genuine, meaningful, significant stimulus across the finish line. This will go down as a travesty in American history, because many people in this country cannot sustain one more blow. While we wait for Washington to hear the pleas of American families, we must keep each other safe from this disease. As painful as it is, we must hold the line, avoid another stay-at-home order, battle through these next few months, give our hospitals some breathing room, and save thousands of lives until we can get to the other side of this difficult time. Our single best weapon in the weeks ahead is all of you, and the individual and collective actions that we take as a state to get through this. Those will really matter. As always, these mitigations are based on the latest science and data focused on what will keep people safe. You'll notice that retail stores, as well as personal services where you can keep your mask on, will remain open at limited capacities. Gyms can allow individuals to schedule workouts as long as they wear masks throughout. Schools and daycares can choose to remain open, but with the precautions set out previously by IDPH and ISBE. We continue to rely on local school boards to determine the right approach here. We've provided extensive IDPH attendance to schools, and I urge local officials to carefully consider that, as well as the unique needs of their students and their communities. So far, most public schools have chosen e-learning and hybrid learning solutions, and daycares continue to operate relatively safely. Safety and health is my primary concern, and with Tier 3, the doctors have struck a careful balance based upon what the data and studies show about the risk of contracting the virus in various settings. Unfortunately, no matter what we do to mitigate the potentially damaging effects of this virus, it will require some sacrifice. These mitigations pause a number of indoor activities where the science shows us this virus can most easily spread. Museums, theaters, and casinos will need to temporarily close. Indoor recreational activities, including youth, club, and adult sports, will need to take a pause until we can get our spread under control. All workplaces that have remote capabilities should have their employees work remotely. If you are able to work from home, we need you to do so. For businesses affected by the virus, please apply for the business interruption grants that we created to help you through these times. They can be applied for on the DCEO website at dceo.illinois.gov. Folks, this is not a time to be out and about. Stay home as much as possible, whatever your job or school will allow. While we fight this latest COVID storm, our guiding principle about interactions outside your family bubble remains this: if you don't need to do it, don't do it. I know that this virus is taking its toll in so many ways. We all want this to be over. We want to fast forward to a world where masks are once again things that only doctors wear, where grandparents can hug their grandchildren, where Thanksgiving tables are full of loved ones and friends and neighbors, and where handshakes don't add fuel to the fire of a worldwide pandemic. But I know with my whole heart that we will get through this. A vaccine is coming. We just have to keep going a little bit longer. We have to keep going so that when we get to the other side of this pandemic, we will have done everything we can to get everyone there with us safely. So thank you, and with that, I'd like to turn it over to our Director of the Department of Public Health, Dr. Ngozi Ezike. Doctor.
Good afternoon. Well, we anticipated it, and we warned about it, and we all knew it was coming. The second wave is now here. But it's not only here, it's more dire than what we saw in the spring. To slow the spread of the virus and to help prevent more cases, more hospitalizations, more deaths, more mitigation measures are being implemented. The science is there, and it's pretty simple. If you're not in the physical presence of other people, the virus can't spread to someone else. It can and will spread at a party. It can and will spread at a dining establishment. It can and will spread at a large Thanksgiving gathering. It can and will spread at a wedding. And it can and will and has spread at funerals. It's like dominoes. If you take one or two out of the line, the dominoes stop falling because there's not something to hit. We've got to take things out of the line so there's not something to hit. Nobody takes this lightly. No one is ignorant to the acute difficulties that so many people and industries will face. But we are really hoping that these additional mitigations will do the trick. We were hoping not even to get here, but as the numbers climbed, we cannot, in good conscience, let our behaviors and activities go unchecked. Today, we are reporting 12,601 new cases for a total of 597,849 cases in Illinois. We've received report of 97 additional lives lost for a total of 10,875 deaths. Overnight, 5,887 people were in the hospital with COVID-19. That is 1,000 more than we had at our peak in the spring. Of those 5,887, 1,158 patients were in the ICU, and 545 patients were on ventilators. In hospitals throughout the state, 1 out of every 4 patients has COVID, and that number is only going to grow. So if those COVID numbers grow and flu hospitalizations will grow, where will someone go with chest pain? Where will they go if they acutely notice facial droop after a car accident? We have to be able to take care of all of the people of Illinois and have the hospital capacity to do so. In the last 24 hours, 94,205 tests were reported for a total of more than 9.25 million tests in Illinois. People are going to be frustrated. People are going to be upset. People are going to be downright angry. Right now, this virus has backed us into a corner, and we are left making insanely difficult and weighty decisions. We all want to get back to normal, but we can't get there just yet. I urge people to turn their frustration and their anger into something positive. Instead of trying to buck the mitigations, can we all just follow them, acknowledging that these are what are needed to get back to some semblance of normal? If we can look out just a little bit further, we are starting to see the finish line. There's definitely still lots of hills and hurdles ahead of us, and the race is not over, but we're going to get there if we keep pushing. Let's push back on the COVID fatigue. We need to stay home as much as we can and break the cycle of transmission. Implementing additional mitigations was not an easy decision and was not entered into lightly. But speaking as a health professional, as a public health professional, as your director of public health, my job is to protect the health and wellness of the people of Illinois. And I'm supposed to protect that through prevention and through the control of this disease. We have tried to do it one way, and it's not been enough. We all see that it's not working and that we're going in the wrong direction and headed over a steep cliff. Please stay at home. Please wear your mask. We can get there.